County Public Health Officer, Dr. Aaron Staples from the Division of Vector-Borne Diseases with the Center for Disease Control, Patty Mason, the CEO of UC San Diego Health, Dr. Eric McDonald, Medical Director for Epidemiology and Immunization Services Branch, and Dr. Nikki Fantidis, the Chief Medical Officer, County Health and Human Services. On January 29th, we came before you to discuss our work to monitor, coordinate, and prevent the spread of coronavirus here in San Diego County. A lot has happened since then. Our county public health officials gave another public update on February 11th. Our highly qualified team of county public health experts has been doing a great job. They have been eternally vigilant. They have been working incredibly hard. They've been in constant communication with the National Centers for Disease Control and Prevention, with officials at Marine Corps Air Station Miramar, the California Department of Public Health, and the local medical community. The role of the County Public Health Department is to ensure that we keep San Diegans safe, to ensure that we protect public health. Today, acting out of an abundance of caution, the County of San Diego is taking an administrative action by declaring both a local emergency and a public health emergency. We are doing this to best position our county to contain and confront the novel coronavirus called COVID-19. Let me be clear. This action does not signify an increase in the risk to the residents of San Diego County from coronavirus. This is a step that positions us best to confront the challenges of this virus. This action best equips us to be in the strongest position to coordinate efforts, ensure access to available supplies, and best protect public health. This declaration that we're taking today empowers the county to best respond locally by seeking and utilizing mutual aid, potentially obtaining reimbursements, and ensuring that county public health professionals have all the necessary tools at their disposal to keep our communities safe. For example, by declaring a local emergency and a public health emergency, we are better able to provide direction and ensure resources to first responders, hospitals, and members of the local medical community. We are better to quickly access a stockpile of medical supplies and gain access to more hospital beds. We're able to quickly access emergency funds at the state and federal level and reimbursements if it should become necessary. Again, to be clear, today's action does not signify any increase in the risk to the residents of San Diego County, but it does signify another step in the county's ongoing efforts to best protect the public, to remain eternally vigilant, and to take every action we believe puts us in the strongest position to ensure the health and safety of the residents of San Diego County. This declaration of a local emergency and a public health emergency is going into effect immediately, and it will remain in effect for the next 7 days. Under the Public Health Medical Emergency powers, the County Board of Supervisors must review the public emergency declaration within the first 7 days of the declaration. Because of this requirement, the County Board of Supervisors will hold a special meeting on Wednesday, February 19th at 2 p.m. to review and ratify the declaration. Upon this action, the state of emergency will be extended for 30 days. Our board will have to meet every 30 days to extend the declaration if the conditions warrant. We take this issue that we're being confronted with coronavirus very seriously. We are very vigilantly monitoring the situation in real time, and we are doing everything possible to protect the residents of San Diego County. To keep everyone informed, the County of San Diego will be posting updates. For up-to-date information, go to our County Health and Human Services website at sandiegocounty.gov/HHSA. You can also call 211 to receive updates about coronavirus and what you can do to prevent its spread. I now would like to turn the microphone over for an update from our County Public Health Officer, Dr. Wilma Wooten. Dr. Wooten?
Good afternoon, everyone, and thank you for being here. And thank you, Supervisor Fletcher. Currently, there are over 63,000 cases and 1,400 deaths associated with the global COVID-19 outbreak. In the United States, there have been 15 confirmed cases related to COVID-19, 2 of them locally, as you know. In the past or the last few weeks, we have heard myriad concerns from individuals and organizations throughout the County of San Diego. And I want to take the opportunity to assure you that the risk to the general public is still low. Despite this limited risk, And out of an abundance of caution, I can confirm that the county is declaring a health emergency, as has already been stated, as well as proclaiming a local emergency. So a local health emergency and a local emergency. Again, let us be clear, as has already been stated, that this does not mean that there is any increased risk to the general public. In fact, it is quite the opposite. This is an action taken that is meant to reassure the public that health authorities are proactively working to stay ahead of any challenges that may arise, and we've seen many challenges over the past several weeks. Additionally, these actions empower the county to more effectively respond to COVID-19, to seek and utilize mutual aid, to potentially obtain reimbursement, and ensure that the county's health professionals and other local stakeholders have all the necessary tools at their disposal. With the end of the quarantine, federal quarantine at the Marine Corps Air Station at Miramar coming to an end next week, our focus is now on monitoring travelers that are arriving in the U.S. from non-Hubei province in China. These low to medium risk individuals will be on home quarantine and self-monitoring under the careful supervision of our local health department. Now I would like to introduce Dr. Eric McDonald, who is the Medical Director for our Epidemiology and Immunization Services for the County of San Diego.
Good afternoon and happy Valentine's Day. I want to describe our local policies and procedures and our local numbers for what we're doing in the health department, and this is completely separate than the activities at Miramar. I just want to make that very clear from the beginning. The local medical community has been consulting with the county health officials on potential cases of COVID-19 in people who've traveled to China or been in close contact with a confirmed case. Generally speaking, these are individuals who are considered to be at low or medium risk but have a travel history to mainland China, but not to the city of Wuhan or Hubei province. For monitoring these individuals, we're following the CDC's guidance for risk assessment and management of people with potential COVID-19 exposure or patients under investigation, or PUIs. Due to patient privacy, I'm not going to discuss specific patients under investigation for COVID-19 or people under self-quarantine. But I will be able to give you some specific numbers of what we've done so far. For San Diego County residents who were PUIs, we've had 7 so far. 5 of those have tested negative, and 2 of them are pending results. We have also monitored within the county 4 non-residents of the county, they just happen to be in the region, who were 2 were negative for the virus and 2 are still pending results. We also monitor individuals who are returning from China with no symptoms. These are individuals at low or medium risk. We usually get about 20 to 30 individuals notified to us per day. We currently have had 171 individuals referred to us so far. 48 of those individuals have actually cleared the amount of time that they need for self-quarantine, and 123 are still undergoing monitoring. None of these individuals have become a person under investigation. In addition, we also are notified of individuals who are on flights who were next to people who were confirmed COVID-19 patients. That is, they were in the same plane for some period of time. They themselves weren't in China, but they were next to somebody who was later found to be one of the diagnosed cases in the United States. Of those individuals, there have been 13 San Diego County residents that we have been notified about. 8 of those individuals have been cleared from the amount of time they were exposed and could have developed symptoms. 4 of those individuals are still being monitored. 1 of those individuals became a person under investigation, and that person tested negative for the virus. So that summarizes what our local activities have been. I can tell you that we've had no one who is a PUI outside of the individuals at Miramar who's been hospitalized for evaluation after being determined to be a PUI. They've all been monitored at home. We will continue to work with our local healthcare community to provide consultation and direction on those individuals, and I'll be prepared later for questions. Thanks.
Thank you, Dr. Wooten, and thank you, Dr. McDonald. We appreciate both of your hard work. Next up, we're going to hear from the CEO of UC San Diego Health, Patty Mason. Patty is here to read a statement on behalf of her clinical staff. Patty?
Good afternoon, and thank you so much. I'm Patty Mason. I'm CEO of UC San Diego Health. UC San Diego Health specializes in the care of adults with complex illnesses, including infectious diseases, and our decision to accept these patients reflects our commitment to the community and our knowledge that we have a deep bench strength in these areas. We are currently caring for 2 patients who were transferred from MCAS Miramar that are confirmed positive for the novel coronavirus. One patient is doing well. The other is in fair condition. We are also caring for several patients under investigation who develop symptoms that warrant further observation and testing. As needed, UC San Diego Health will continue accepting and caring for patients under investigation. We have instituted standard infectious disease protocols as well as additional precautionary measures to prevent possible exposures as we care for both potential and confirmed COVID-19 cases. Declaring a state of an emergency in our county is important so that those of us caring for patients have the necessary resources and funding to respond to the novel coronavirus. We are confident in our expertise and ability to provide effective, safe care without significant risk to patients, visitors, healthcare workers, or our community. We have extraordinary clinicians across every department on the ground in this fluid environment to help people and to do it safely and effectively. We want to assure the public that you are under no additional exposure risk by visiting any of our hospitals or our clinics. Patients should feel confident making and keeping their appointments and using UC San Diego Health Services as usual. Lastly, I want to express my deep gratitude to the CDC and to the county and to CDPH and the state. We've had incredible coordination and support, and deeply appreciative of that. Thank you.
Thank you, Patty. We want to thank all of our healthcare providers that have been wonderful partners in this effort. Our final speaker before we go to questions is the Chief Medical Officer for the County of San Diego, Department of Health and Human Services, Dr. Nick Ifantidis.
Thank you, Supervisor Fletcher, and good afternoon, everybody. I just want to continue with the theme of appreciation and acknowledge what an unprecedented coordination this has been between our local health authorities, our local health systems, our federal authorities, and how collaborative and coordinated and seamless it has been. I also wanted to specifically, you just heard from Patty Mason in terms of UCSD's involvement, but I wanted to publicly thank and express appreciation to a few other key partners, particularly Rady Children's Hospital and their leadership and their clinical team that has provided such cooperative and competent and compassionate care to the children that required further evaluation. I also want to mention American Medical AMR, American Medical Response, which has been our partner in terms of doing the transportation to the healthcare facilities. And I also want to publicly acknowledge the work of 2 additional health systems that in the recent days have mobilized their efforts to prepare additional inpatient hospital capacity should that be needed, with a special appreciation to the executive leadership and to the clinical staff at both Sharp Healthcare and Scripps Health here in San Diego County. With those remarks, I would like to now field questions and direct them accordingly to our folks who have spoken, as well as Dr. Staples, who is here from the CDC, and Brett Austin from our Public Health Laboratory, who serves as the director there. When you ask your question, if you could please articulate and introduce yourselves so we know where it's coming from, and I will direct the responses accordingly. Thank you. Yeah, I think it's already been stated, but I will restate it simply. This is in order to position us to be prepared with additional access to resources beyond the current capacity. Practically speaking, it also provides the county some flexibility in terms of making decisions of potential relationship with contractors that under different circumstances we would have to go through a more formal and laborious process. And there are some other details as well that are involved with us, if needed, we are not at that point yet, mobilizing members of our Medical Reserve Corps and other such actions. It is really a proactive step of prevention and protection and to position ourselves accordingly with additional resources. Yes, ma'am. Dr. McDonald, I think I'll ask you to respond to that. And let me repeat it. I've been asked, since we're on time today from other events, the question is, what are we doing to monitor folks who may be crossing from the border with Mexico?
And I will give a 50,000-foot level view because, again, our partners in the Department of Homeland Security are actually responsible for individuals who are crossing the border, so CBP and ICE. They, of course, get travel histories on individuals when they're evaluating them for entry into the country. They have actually standard procedures that they use to determine whether somebody might be a person who could have a travel history consistent with being eligible to be a person under investigation. They then do an assessment medically on these individuals, and if at any part of the process, either under CBP custody or in ICE custody as respective, they might be identified as an individual who is a potential person under investigation, then they will either bring the patient to the next level of care, which has occurred a couple of times in the county, or they would contact us directly in the health department to arrange testing. We have had 2 such individuals so far who were in ICE custody, who were presented to us as possible persons under investigation. We still have tests pending on those individuals, and those individuals remain in isolation.
Yeah, besides the, yes, I will respond. The question is in terms of the number of folks at UCSD that are there that are still under investigation. UCSD currently has in its care 7 individuals. 2 of those, as you already have heard, are positively confirmed cases. There are 5 individuals at UCSD who are pending their results that we would classify as being persons under investigation. Thank you. The folks at UCSD that are there did come from Miramar, yes. Yes, sir. Introduce yourself, please. I'm going to have Dr. Staples come up and just make a couple comments from the general perspective of the CDC. And again, she is a medical epidemiologist now with us. Some of you had the opportunity to meet Dr. Chris Braden, who was here before. Dr. Staples is now serving in that role. Again, the declaration is one of proactive preparation, and we took multiple factors into consideration, the possibility that there could be further involvement of the COVID virus in our community is certainly part of that deliberation. Dr. Staples, would you like to make some comments from a general perspective, please?
Thank you very much. Sure. My first name is Erin, E-R-I-N, Staples, S-T-A-P-L-E-S. So first of all, I'd like to thank very much for the county for inviting me to be here today, but more importantly for having the proactive stance of declaring an emergency, which allows them to get prepared for what we're seeing as a global health crisis with the spread of coronavirus. CDC, of course, had already declared the same public health declaration in terms of activating our emergency operations centers and mobilizing our personnel to allow us and help us to respond. But I can't applaud the individuals here, particularly our colleagues in the county, our clinical staff at UCSD, and more importantly, the servicemen at Miramar for really giving us the opportunity to help reintroduce or repatriate individuals who could have been exposed to the virus. Everything has been working very well in that operation, and we have identified 2 cases, which was expected when you start moving people from an area that has a lot of virus circulation, but we have not identified any other individuals at that time. We're continuing to monitor, and again, cannot thank our county, the state of California, as well as the clinicians that are in the community assisting us and the servicemen on Miramar.
Thank you, Dr. Staples. Yes, sir, in the back. I can guarantee you that all of the individuals that came from Wuhan to San Diego at Miramar Air Force Base are still under formal quarantine. Yes, sir. Yes. A little. Sure. I'm so sorry.
Yeah, no, that's again, it's a slightly different question. And again, it's easy to confuse what is going on under federal quarantine at Miramar with our community response. And so I want to just clarify that very quickly. So there were 13 San Diegans who were on flights next to people who were subsequently diagnosed in the United States. Part of the CDC's investigation of all those cases is to find out everybody who was near them on the travel that they took. And they get the names and the addresses of those individuals, and they send that out to the states. Then that goes down to the local jurisdictions. So we found 13 of those individuals who were San Diego residents. And again, the stats that I gave before were that 8 of those individuals have gone 2 weeks past the time that they were next to those individuals, so we know that they are cleared from a need for self-quarantine. The other 4 individuals are still self-quarantined at home.
Thank you, Dr. McDonald. I apologize for that confusion. Paul. I can confirm that the process for testing is still in Atlanta. We are working in close collaboration with the CDC to enable local testing as well as state testing. As has been reported in other media contexts, that process is still being finalized. Yes, ma'am, in the middle. Dr. McDonald.
Yes, thank you for that question. First of all, I'll take the second part first. Is it safe for them to be where they are? ICE at Otay Mesa has a number of isolation rooms that they routinely use for things like possible tuberculosis and other air transmissible diseases. And one of the things that's important to know is that this disease, COVID-19, is handled exactly the same way as these other aerosol transmitted diseases. So they have that capacity, they're simply using it for that. So they are safe, where they are, not exposing anybody else who's in the facility or the staff there. And there was a first part to your question. Oh, any details about the individuals themselves and their travel histories, I would refer to ICE.
Yes, sir.
Actually, any of the questions that have to do with what ICE does as their procedures and policies, I would refer to their officials. But we do work closely with them, and we are routinely working with them and other partners to do close contact investigations if required. That generally means if the person's confirmed for the COVID-19, and the only confirmed cases that we've had have obviously been at Miramar, so there hasn't been a need for that. I don't at this time.
We do not. Yes, ma'am.
Again, I refer that to ICE.
Yeah, I think we would refer that to ICE, please. Paul? Dr. Staples, please.
Thanks for the question. In terms of the individuals, we actually were a little delayed getting here because we were meeting with both of the sites that are housing those individuals right now. We received some very positive feedback, and someone even joked that he gained 5 pounds because he's getting better food here than he is getting at home, per se. So we are, as part of the team that we are here with the CDC, we do contact investigation tracings for anybody that was potentially even in contact with those 2 known cases. We are working on completing all of those contact investigations, but we have not identified anybody else that we believe was at substantial risk. And so we are going through the procedures that and the guidance that we've put out in terms of contact tracing. So we will likely be, because of just some exposures, following a couple more, but they will not be housed at the base. We're working on, because of their low-risk exposures and the current protocols, to have them monitored by their local health departments. Thank you.
Yes, ma'am, in the middle. Yeah. Dr. Staples, may I ask you again, forgive me for the long trek back to the microphone, to respond to that? I am not aware that the CDC has formally changed any guidance, but these evolving questions related to the incubation period, please.
Thank you very much again. So in terms of the incubation period and the amount of information that's informing that, we obviously are constantly engaged and aware in obtaining information to ensure that the information and the current incubation period that we have teams of individuals working in Atlanta that are looking at the different information and using even models to predict the precise accuracy of the incubation period. None of the data that has been provided to date has suggested that beyond that 14 days is really where we need to be considering. So we are currently, based on the available data, using the 14 days, and that's our recommendation or guidance right now.
Okay, this is going to be the last question. I'll call on somebody who hasn't been called yet. Yes, ma'am. It'll probably be in the next 2 to 3 days is what I think I can respond to, okay? We expect that in the next 2 to 3 days. I want to again thank you, especially on this Valentine's Day, for your availability, and I'll turn it over to Supervisor Fletcher for a couple closing comments.
Thank you. Thank you, Dr. Nick. Again, I want to thank all of our public health advocates and experts who are here. Again, we're taking this action out of an abundance of caution to do everything possible to prepare ourselves for a situation that is dynamic and fluid. We will continue to monitor it, and we'll continue to make regular updates as more information becomes available. So thank you again to everyone who's doing the hard work on the ground, and we will be having a board meeting on Wednesday to review this declaration and decide if we should extend it for the full 30 days or not. That's it. Thank you.